Aging brings with it a gradual but persistent transformation of the immune system, a process known as immunosenescence that leads to increased susceptibility to infections, cancer, and chronic diseases. One of the hallmark features of this transformation is inflammaging, a term coined to describe the chronic, low-grade inflammation that silently escalates with age, even in the absence of infection. This persistent inflammatory state is driven by both innate and adaptive immune changes, and it is now understood to be a central contributor to the pathophysiology of aging. Yet centenarians, individuals who live beyond 100 years and often avoid or delay major diseases, appear to defy this pattern. Their immune systems are not preserved in a youthful state per se, but rather recalibrated in a way that balances immune competence with controlled inflammation, providing crucial insight into the biology of healthy aging. Aging typically leads to dysregulation in both arms of the immune system. The innate immune system, our first line of defense, tends to become hyperreactive, producing excess pro-inflammatory cytokines such as interleukin-6, IL-6, tumor necrosis factor alpha, TNF-A, and C-reactive protein, CRP. This contributes to systemic inflammation and promotes tissue damage, insulin resistance, and vascular dysfunction. At the same time, the adaptive immune system becomes less responsive. The thymus shrinks, reducing the output of naive T cells capable of recognizing new pathogens, and the diversity of the T cell repertoire diminishes. B cells also produce fewer and less effective antibodies. Natural killer NK cells, key players in antiviral and anti-tumor immunity, tend to increase in number but lose functional capacity. In contrast, centenarians exhibit a distinct immune signature that sets them apart from typical aging patterns. One of the most striking findings across multiple studies is their ability to maintain lower circulating levels of IL-6, TNF-A, and other inflammatory mediators compared to age-matched peers. This anti-inflammatory profile is not absolute, but it reflects a better controlled inflammatory set point that likely plays a protective role against a range of age-related pathologies, from atherosclerosis to cognitive decline. Importantly, this reduced inflammatory burden is not due to immune suppression, but rather to immune remodeling, a strategic adaptation that preserves essential immune functions while minimizing harmful overactivation. T cell profiles in centenarians provide further insight. While naive T cells typically decline with age, many centenarians retain a relatively diverse and functional T cell pool. They often show a greater proportion of central memory and effector memory T cells capable of mounting effective responses to previously encountered antigens. Some studies also suggest that centenarians have increased levels of regulatory T cells, TREGs, which help control inflammation and prevent autoimmunity, potentially contributing to their immune balance. In parallel, their NK cells, although numerically abundant like in other older adults, appear to retain better cytotoxic function, allowing them to respond more effectively to infected or transformed cells. The underlying mechanisms that support this immunological balance are complex and likely multifactorial. Genetics plays a role. Longevity-associated gene variants, such as in FOXO3A and IL-10, may support anti-inflammatory signaling and immune resilience. But lifestyle and environmental exposures over the life course are equally critical. Many centenarians have lived in environments that promote physical activity, maintain low levels of psychological stress, and encourage diets rich in anti-inflammatory nutrients. These exposures modulate the microbiome and epigenome in ways that help preserve immune function and reduce chronic inflammation. Gut microbiota diversity, for example, is more robust in centenarians compared to elderly individuals with similar chronological age, and this microbial richness correlates with the production of short-chain fatty acids that support regulatory immune pathways. Moreover, some centenarians appear to benefit from a form of immune selection over time. They may have survived infections and environmental stressors that eliminated individuals with weaker or more reactive immune systems, resulting in a cohort of older adults whose immune systems are unusually stable and efficient. This concept, sometimes referred to as immune compression of morbidity, suggests that successful aging may involve not the absence of immunosenescence, but its postponement or modulation. Understanding how centenarians keep inflammaging in check opens new doors for promoting health span across the population. Emerging interventions such as caloric restriction, senolytic therapies, anti-inflammatory compounds, and microbiome modulation aim to replicate some of these effects. By focusing not just on boosting immunity, but on balancing immune activation and resolution, we may be able to reduce the chronic inflammatory burden that underlies so many diseases of aging. Centenarians demonstrate that aging of the immune system is not a one-way decline. Through a combination of genetic inheritance, adaptive immune remodeling, favorable environmental exposures, and possibly even stochastic survival advantage, they illustrate how it is possible to maintain immune competence while avoiding the damaging consequences of chronic inflammation. Their biology underscores a hopeful message that the immune system, though subject to time, is far more plastic and capable of graceful aging than once believed.